Alright guys, here are 2 terms you should mention to your doctor when discussing prostate cancer screening with them: overdiagnosis and overtreatment. Or should I say incontinence and erectile dysfunction? First off, let's discuss why it's important to get screened for prostate cancer. Alright, it's estimated that 12.9% of men will be diagnosed with prostate cancer in their lifetime. In 2022, there were about 3.5 million men living with prostate cancer in the US. It's estimated that there will be approximately 313,000 new cases of prostate cancer in the US this year. Alright guys, that's 15.4% of all new cancer cases. Unfortunately guys, about 36,000 men will die from prostate cancer this year. That represents about 5.8% of all cancer deaths. That number, ladies and gentlemen, makes prostate cancer the 5th leading cause of cancer deaths in the US. Alright, the general recommendation is that men between the ages of 55 and 69 get screened for prostate cancer. But sometimes you might need to be screened for it as early as age 40, depending on some factors, such as family history and race. If one of your first-degree relatives, such as your dad or your brother, was diagnosed with prostate cancer, you should definitely get screened for it early. The test used to screen for prostate cancer is a blood test. It measures your PSA, prostate-specific antigen. Don't be scared. A rectal exam is not required for screening purposes. The issue with the PSA test, though, is that it's known for a high rate of false positives. And a false positive PSA test could lead to more invasive diagnostic studies, which could lead to treatment and sometimes overtreatment. And side effects of treatment include erectile dysfunction and incontinence. So before you decide to get screened for prostate cancer, make sure that you discuss the benefits and harms of screening. Depending on your situation and background, the risks associated with screening could actually outweigh the benefits. So if you're between the ages of 40 and 69, you should definitely discuss prostate cancer screening with your physician. However, you should also discuss overdiagnosis and overtreatment. Alright guys, share this video with every man you know between the ages of 40 and 69.